It was almost like I thought I was waking up, but then I didn't see anything when I thought I was opening my eyes. And the best way I can explain it was I lost awareness of my body, but I felt all the shaking in my mind to where I describe it as like my mind, like my brain was like scrambling or like malfunctioning. And as it progressed, I started to think like, oh man, am I having a seizure? And I was like, this is weird. It doesn't hurt. Like I'm not scared. I'm just like, what is going on? This is weird. And then it kept progressing to almost where it felt like my head was like tilting back and then like up to the left as it was like magnifying. And then I blacked out. And we're recording. What's up, everyone? Welcome back to the Gray Matters podcast. I am rejoined by the original lovely Jackie Lauricella,
Hello.
my former co-host. Today, we're coming to you together for two reasons. One, I'm trying to get Jackie to get back more on the Gray Matters podcast, whether it just be her and I, it'd be a guest, or it'd be her by herself. Who knows? Second, today we're talking about the seizure I just had 2 days ago. When this is coming out, it'll probably be on Friday, so it'll be 6 days from when I had the seizure. And I thought it'd be interesting to talk about that for the obvious, but also get Jackie to share her perspective since she was the one that discovered I was having a seizure at 2:30 in the morning in my sleep. So with that said, why don't you say hello, and then we'll just kick it off with your perspective since you were the one that was first aware of it.
Yeah, for sure. It's good to be back. Is the AC gonna be okay being on?
Yeah, let's pause that so I can turn the AC off. And we're back. It never fails. Whenever I go to record, the AC always turns on and it takes over. So what we're going to do, we're going to start with Jackie just talking about her perspective of finding me in my sleep.
Yeah. So it's good to be back. Wish it was on different circumstances than this. But maybe it'll spark me coming back more regularly to the podcast. Who's
That's
to
the
say?
goal.
Yeah. So I was laying in bed and we were actually like back to back. So I kind of was feeling Josh move a little bit and I thought maybe he was about to get up or something. And then it just seemed really off. And right away, I kind of knew that he was having a seizure. I do have a medical background, so maybe that was the reason why, or that explains it. But I kind of understood right away what was happening. So I got up and grabbed a sweatshirt and threw it on and turned on the light. And then, I mean, it sounds like I did a lot of things in between, like getting to him and not, but he was already on his side. He was on the bed, he wasn't falling, and I knew kind of what was happening. And that's pretty much all you can do if someone's having a seizure is just wait it out. And I was timing it more than anything. So I grabbed my phone, put on a sweatshirt because I was just in a bra and underwear, and I knew I had to call 911 because he's never had a seizure while we were together before. It's
I haven't
always
had one since I was 16, which was 16 years ago.
right.
And it happened when I was knocked out from hitting my head so hard. My
Yeah.
friend is the one that saw it, so that's what he told me.
Following a head injury, that's, it can be to be expected a little bit, but this was just out of the blue. Knew I had to call 911, so I tried to see if I could reach him in any way by like saying his name. I made sure he stayed on his side. I called 911. And yeah, I looked at my phone. It was right around 2 in the morning. The seizure lasted about 2 minutes. It was convulsions and muscle tension, and there was some blood coming out of his mouth, so I knew he had bit either his tongue or his cheek, but it wasn't too much, so I knew he didn't like bite off his tongue or off a piece of it or anything, which was a positive in that situation. His lips were a little blue, which was concerning, but he was breathing the entire time, which was a huge relief. At least it sounded like he was trying to inhale through his nose, but his body was just very, very tense, and his arms were kind of stuck here, and he was just shaking really hard. The 911 operator told me that they had activated dispatch and that I needed to put away any pets and unlock the front door for them. And I was like, I don't want to leave him. I don't know what to do. So I just kind of tucked some pillows underneath him because at that point he had stopped seizing and he was kind of going in and out of consciousness, and he would try and sit up and I would push him back down and try and talk to him, but he was never responsive. His pupils were like super dilated, and he would like look at me and very clearly see me, but it was a very confused, like he wasn't responding to any kind of verbal cues. But then he would like fall back asleep, and he was breathing the whole time and he was doing fine. And so I was like, shit, I have to do this really fast if I want to. I didn't want him to get up and fall or something like that, or get hurt trying to stand up if he was just completely delirious. So luckily we had a bathroom in our room at the house that we were staying out on the beach, because we were out there with some family. And I tucked little cheese man away really quick, went and unlocked the door, and woke up my cousin and was like, hey, I kind of need your help. I had to call 911. Josh had a seizure. And so she got up, and I had put a pair of pants, or like a pair of leggings on. And at that moment, when I got back to Josh, I realized that my sweatshirt was on inside out and backwards, and my pants were on backwards. So she was in there and holding the phone, and we were still talking 911 and saying that they were on their way. And I had to like switch my pants around at least a little bit. I didn't notice my sweatshirt until later. But he regained consciousness again and kind of like locked eyes with me again. And I had to push him back down and asked him if he was in pain, and he still didn't respond to me. But he was able to see me and kind of follow instructions a little bit better. So that was good. I knew he was improving, like he was coming to a little bit more. And then that's when EMS got there, and he was in and out of consciousness. So when they got there, and they kind of like, one of the guys put his hands on him, and he was like, hey man, like, are you okay? How are you feeling? And he was just really startled, and he was kind of looking around. And I was like, Josh, do you know where we are? And he goes, are we not at home? I was like, no, we're out at the beach. We're at the rental house. And he was like, okay. And I was like, I had to call 911. You had a seizure. And he was just kind of looking at me, and I was like, can we go to the hospital? I'm really scared. I want to go to the hospital. And he was like, yeah. And then he sat up, or they sat him up, and he got really nauseous, and he was like gagging and trying to hold it, which was nice. But, and they were like, oh, let me get you a bag. And then as slow as humanly possible, got him a bag. So he threw up on the floor.
Oh, did I?
Yeah. And then they gave him the bag, and he threw up a couple more times in the bag. But one of the guys was actually nice enough. He like went to the kitchen and grabbed some paper towels and like wiped up the throw up a little bit. And he was like, this isn't like sanitized and clean. I just wanted to get it out of the way. So after that, when you were done being sick, they kind of got you up and put you, they didn't have a stretcher. They had a chair. And then I think they transferred you to the stretcher, but I wasn't there for that. And all the beach houses out in North Carolina are up on stilts. So they had to like get him out down some pretty steep stairs. So it was making me uncomfortable to watch them navigate him down the stairs. I was like, please don't drop it. Like, and it was like freaking me out. So I was like, you know what? I'm just going to get my life together, because I knew I was going with him. So I went and got a purse together, and that's when I realized my shirt was on inside out. And of course, they asked me a bunch of personal information about Josh, if he had epilepsy, if he was a diabetic, if he had been taking any drugs, if this has ever happened before, his name and address. And I was communicating with them and giving them the information. And
almost got my birthday wrong.
Yeah, I did. I said the wrong birthday. They were like, when's his birthday? I was like, November 18th, 1988. And then I was like, no, that's not it. It's the 20th. It's November 20th. I don't know whose birthday is November 18th, but I had it. And I know that it wasn't like a fight or anything, but I got his birthday wrong once, and he was like, what? And he was like really offended and gave me shit about it for like 3 days. So, and he was like up, and I was like worried that he would hear me, and I was kind of hoping he would say something to me about it, but he wasn't paying attention. So they wouldn't let me go into the ambulance because of COVID precautions and things like that, which I'm vaccinated, and I would have worn a mask and stuff. And I asked them, and they were like, no, absolutely not. They asked if we wanted to take him to a local hospital or a level 2 trauma center. And I was absolutely like, take him to the level 2 because I had no idea what was going on. I was like, maybe he had a stroke, like maybe something. So I wanted him to go to a trauma center. And unfortunately, it was 40 minutes away. So thankfully, I woke my cousin up and she was able to drive me. And that's most of the incident. What do you remember from it?
Yeah, so I'm talking kind of funny because I guess I bit like the back of my tongue on either side. So I have all my molars because my wisdom teeth grew in straight. And I think that's because I had braces when I was younger, and these two teeth and these two teeth pulled. So I think they all came in. But I have like a bunch of scarring on the sides of my cheeks from my molars just biting my cheeks just when I chew normally. And so I think that's what the blood Jackie was talking about is like,
Yeah.
I don't know if you can see it in the video, but like there,
The front of the tongue is like bruised.
there, and then like on the front.
And just a PSA for anybody, if anybody sees anyone having a seizure, they're not going to swallow their tongue. Like it's just, it's a myth. That's not going to happen. That's always like the first thing, like, oh, don't you stick something in their mouth so that they don't swallow their tongue. And like, you can't swallow your tongue. You can try right now and you're not going to be able to do it. Like, and it's even during a seizure, you're not able to swallow your tongue. So don't stick your fingers in somebody's mouth. They will bite it off, or other objects or anything like that. You just turn them on their side. The best thing to do is to time them and to notice all the little things that are happening, like the type of jerking their body's doing, what their eyes are doing, little things like that, and to just try and communicate to the person in case they can hear you. Don't put anything in their mouths. It's normal for them to bite their tongue a lot.
Yeah, so the back sides from my molars and then the front. I think the front, it's like really bruised. I think it's just from like pushing it against my teeth because there's no incision and there's no like scrapes or anything. But anyways, that's why I'm talking kind of funny. But what I remember is it was almost like I thought I was waking up, but then I didn't see anything when I thought I was opening my eyes. And the best way I can explain it was I lost awareness of my body, but I felt all the shaking in my mind to where I describe it as like my mind, like my brain was like scrambling or like malfunctioning. And as it progressed, I started to think like, oh man, am I having a seizure? And I was like, this is weird. It doesn't hurt. Like, I'm not scared. I'm just like, what is going on? This is weird. And then it kept progressing to almost where it felt like my head was like tilting back and then like up to the left as it was like magnifying. And then I blacked out. And then I remember like being sat up and throwing up and then blacked out again. I don't remember going down the stairs. And then I remember coming to in the ambulance, sitting up again, and Jackie saying that she'd seen me at the hospital, and the paramedic asking me questions. And I just remember it like, I remember understanding the questions, hearing what she's saying clearly. I'm understanding it very well. I have the response in my mind, but there just being this like delay of time for me to speak it. And I don't think I answered anything incorrectly or said anything incorrectly. There was like this massive lag of like hearing, comprehending, thinking, and then saying what I was thinking. And that seemed to get shorter and shorter, especially once I got to the hospital. Because I think I like kind of passed out a few times on the way to the hospital, or just went by, like the 40-minute drive went by so quick. But then when I got to the hospital, I remember them bringing me in. I remember them having to get me out of the ambulance and putting me onto another bed, I think. And then getting me into the hospital, getting me into the room. And then that's when things started coming to me a lot quicker. I started to be really aware of what was going on more so. And then like the front of my head near my temples, like this whole area started to get like a slight headache. And then as it went on, it was like all the way around my head. And I figured, I was like, well, that's the least of, the suffering that I'm going to be going through right now. Like, I'll take it. I would expect more than that. And then I started to get nauseous, and anyone that knows me, like, nausea is one of my least favorite negative experiences as a human. Like, I'd rather endure any kind of pain, and I have, rather than nausea. Like, throwing up, I don't care for it, obviously, but I don't mind throwing up. It's just the sensation of getting nauseous before you're gonna throw up. Like, that's my least, like, that's
He's
my
a big baby.
that's
about
probably
it.
like my biggest fear. Is just like being nauseous.
Your
Like,
biggest fear.
I hate being like
nauseous.
overheated and nauseous, or just like any kind of like reading in the car and then getting hot. Like, and then getting nauseous. But anyways, that all started to go away. They gave me some like Tylenol and then some nausea medication. And then from there, it was just, they got me in to get a CT scan, and then I got back.
CT scan was clear, no sign of stroke, no bleeding, nothing like that. I think they were trying to
stuck with all these different things and connected all these machines,
Yeah,
and they were like surprised with how many I had when I went to the MRI. Take them all off, which that kind of hurt with like chest hair, and then like
his vitals were stable the whole time. They ran a tox screen because
I was doing some drugs.
Yeah, they couldn't figure out what was going on, so it's something that they need to rule out. Like, I totally understand, but they didn't tell us that they were running a tox screen, which I found, I don't know why they didn't do, like, that has to be like some kind of protocol thing. Like, yeah, don't tell them that we're running a tox screen, just like do it and be like, hey, we found coke in your system, so you lied. But they just like came in and silently collected his urine because it was already in a urinal, and they like left so with bad. It. But I saw them come in with like the baggie and the cup and saw them do it, and I was like, he's not doing drugs. Like, it's fine. But
the thing that, so I guess progressing forward after that, they let Jackie come in, and then shortly after that, they took me back for an MRI, and the whole time I got into the hospital, and I was becoming more and more, I'd say, fully conscious. I that was the weirdest thing, because I was like aware of the seizure happening until I blacked out, and then I was aware when I was coming to, like in and out of passing out and stuff like that on the way to the hospital. I was always aware of what was going on. It just like there was like this lag of me being able to like speak what I was comprehending and like making up for responses.
Yeah, there was a moment where I think you tried to thank the paramedic, like the woman said something to you, and I think you were trying to say thank you, but you were like, you're welcome, and it was just like, well, that was close, that was ballpark. And sometimes I do that, like, and I haven't ever had a seizure, so I was like, all right, he's just very disoriented. But
once I got into the hospital bed, there was this fear of falling asleep, of course. And then after they gave me the Tylenol and the nausea medication, then they gave me like a low-grade dose of anti-seizure medication. And after that...
That was at like 6 a.m. though. He had already been at the hospital for maybe 3 hours at
that was when I got the MRI. It was after that, right?
You got the MRI after the anti-seizure meds.
And I always fall asleep in MRIs. I don't know. It's weird. I guess I'd rather that than listen to the annoying sounds. But I just fell asleep the whole time. And
that was nice. It was like a brand new MRI machine. They gave him a warming blanket.
They had all my blankets, and then a warmed up blanket on top of it, and then they put earplugs in for me, and then they put this like washcloth over my eyes and like tucked my ears in. So I was I think they were maybe doing it for like seizure precautions, but like I felt super snug and just
like cocoon.
Yeah. And I remember at one point they were asking me like if I was okay, because I didn't respond, but I like was like, ears were plugged, I was asleep, and then I was like, yeah, I'm good. And then I remember them telling me I had to come out to get the contrast, and then long before I knew, or I guess however you say that, like before I knew it, the MRI was done, and I was back in the room, and then I was like kind of drifting in and out of sleep because I was just tired because we went to bed around 10:30, and that happened at 2, and then my brain and my body just went through so much energy expenditure and stress.
It's like running a marathon in 5 minutes or less. It's a lot. It takes a really heavy toll. I was really surprised he was able to even stay awake before I got back into his room, because they were actually really weird about me going back. I don't know if it's because we're not married or whatever, if maybe I didn't put my foot down enough, but when I first got to the hospital, they said that they hadn't brought him in yet. Like, his name wasn't in the system yet. And I was like, well, that's crazy, because he's definitely here, because we didn't pass the ambulance on the way, and it was like a super direct drive from Oak Island into Wilmington. It was like 17 just straight there, and like Kristen and I didn't see an ambulance at all, and they weren't going with the lights and sirens. They were just driving. It wasn't an emergent situation to get him there. So they were weird about that. And then when they finally I was like, can I see him? Like, when can I go? And the nurse was like, just not yet. You have to just wait. And I was like, has he seen a doctor? And they're like, yeah, he's seen a doctor. We'll get somebody to walk you back there. And even an hour after that, I had to kind of throw a little bit of a fit for someone to take, and they're like, well, we're a little like busy right now. And, you know, I understand emergency departments are busy. They looked a little understaffed, but in the 2.5 hours I was there, I watched like people move around. I watched nurses go outside for cigarette breaks, which annoyed me for a lot of different reasons. And I watched a nurse like pack up and leave for her shift, like being done. And yeah, you get to go home when your shift is done, but you couldn't like walk somebody back that's been waiting 2.5 hours. I don't know if they're waiting for him to get his CT. And I think that is what stopped me from getting more upset sooner. I have a lot of respect for nurses, and I have a lot of respect for people that work in an emergency room. And I was just like, they're just busy. They're just doing their job. Like, if his situation isn't emergent, like he's not on the top of their list, that's not something I should be complaining about. But, you know, I was like about done at around like 4:35 in the morning. I was like, I need to see him now. And somebody finally took me back. But
everyone for the most part was really nice. All my nurses were nice. Neurologist was nice. The doctor that admitted me,
yeah, the admitting doctor,
I wouldn't
was
say he was
dick.
like rude or a dick. He just was like super like non-communicative. So like Jackie asked a question about when I was going to get admitted, and he was like, well, that's what I just did, but he didn't tell us what he was doing. And he was like really like cold and like dry, which I'm all about, being blunt and dry and
that part
sarcasm.
didn't bother me.
But it was just like the way he handled it. But like the first thing he did when he came in was they turned the lights down for me. He came in and turned the lights on full blast, and Jackie asked if he could turn them back down. He's like, well, they either are on or off. And I wanted to say something. I was like, well, for being a doctor, you have no real critical thinking skills, because the light was just dimmed when you came on, and you just turned it full blast, and like that hurt my eyes, and I have a headache, and I just had a seizure. So it was just weird, but everyone else was great. The neurologist was really nice, and the nurses were nice.
He did a really good job at like explaining things and asking if we had questions and stuff like that.
I had two different nurses
overall,
throughout their shifts when I was there.
Yeah, overall it was a really positive experience. Out at, what was it, New Haven
Regional Medical Center in Wilmington.
Yeah.
And I think, you know, reflecting on the potential cause, I mean, once we got the images, I sent them off to my surgeon, Dr. Alan Friedman at Duke, and my radio oncologist, Dr. Julian Wu at Tufts Medical Center in Boston. And it seems, I forget the exact numbers, 2 years ago on my last MRI from the regrowths from 2017, which is the 4 I live with now. And it seems like the ones in the prefrontal lobe, or the frontal lobe of my brain, have grown.
It's not quite in your
Well, it's
frontal
like
lobe. It's like here.
Yeah, it's like it's off to the side and back a little bit. From the scan, it looked like it was in the front.
Kind of. It kind of looks like midline, but it was
So
like kind of
there seems to be some growth there. So in the matter of 4 years since they've been discovered, it's not that big. The one I originally had removed, if anyone's seen the MRI on my Instagram, it was pretty gnarly.
Like
this one's about
long.
2.6 centimeters.
26 millimeters.
Yeah, so he said about 2.6 centimeters either direction. So I mean, now, so actually to finish that thought, you know, the night before I had a couple really strong dark beers. I had, you know, a piece of some carrot cake, which is a little bit more sugar than I usually eat, and some other carbohydrates.
Bread. Yeah, with the cheese.
And then, you know, just over the last couple months, I've been kind of leaning, like, not lean, like just kind of introducing carbohydrates more, but still staying active, and still using exogenous ketones and berberine. And I don't think it has much, if anything, to do with metabolic purposes, but seeing that where the mass is and that it has grown, and then the alcohol, I think the alcohol, that's something I've been a little bit more lenient with over the last couple months.
Yeah, I think it's been it was like a little bit of everything, you know, right? Because he eats granola and he eats sweet potatoes and stuff like that, but we still don't really eat gluten very often. He might have a slice of pizza one day on the weekends, and if we get noodles or rice noodles. And so I think having just that big combination of like sugar from the carrot cake and like some processed bread and then beer, I think it was just kind of like, and then the new growth, it was just like a lot, like the stars kind of aligned. Right. And something happened. But I'm interested to see what Dr. Friedman and Dr. Wu up at Tufts have to say. If anything, that's a pretty hefty. Like that's like
Stack
a little bit of
team.
a, yeah, stack team. It's like a little bit of name dropping, Dr. Wu up at Tufts and Medical Center. And then like Dr. Alan Friedman, his neurosurgeon over at Duke, is a superstar. So he's in really good
I'm in good
hands.
hands, and I mean, I have a good relationship with the Gamma Knife Company for some years now. So I mean,
Yeah.
there's plenty of options. And I guess the last point I wanted to make to wrap this up is that the way I look at this is just how I look at everything else in my life. Like it's not anything in our control, and this is actually an example of for someone like myself that's battled years of looking for a sense of control and things like that. It's a wake up call to say, hey, you have no control, but what you do have control over is how you respond to things in life and how you choose to show up and what you do with that information. So of course, the first thoughts that were coming through my mind the day after, like 12 hours later, I was completely normal. We were off to Whole Foods and driving back home, and I felt fine.
He didn't have
Headache
another
went away,
seizure. He had
yeah.
no auras,
And at
which
this
is
point,
like,
we're almost we're right around. Well, actually, today's Monday, right? So 2 a.m. So what, I don't know what time it is now, like 5. So the next 7 hours will be 48 hours. So we're 29 hours. We're 20. No,
what are you talking about?
I'm trying to do math right now. 48 hours. So we're at 41 hours from the initial seizure at this point. And 12 hours after the initial seizure, I've been feeling fine. I've been feeling normal. The neurologist said you can return back to the gym, bowling, whatever you want to do. Maybe just take some time to rest, but it's up to you. He's like, you're at a higher risk of seizure from just having the brain surgery and having tumors, of course. And then now having one, we don't know. Even after the scan and seeing the growth, it's like there's still so many things up in the air. But over the course of 11 years, especially with that massive one that I first had that was like this big, this wide, and like that deep, is like you've had this one now. And I haven't had a seizure since I was 16 that was directly after I got knocked out on the ground. So they put me on a low-grade anti-seizure medication. I think we already talked about that. But, the risk of me having another one is just as much as, anyone having a seizure from what I gather with him saying. So, yeah, I have a little bit of a higher risk, but it's still not that bad. So where I'm going with this is I could easily give into the thoughts I had of like, fuck, what if I have another seizure? Like I was driving earlier, what if I have a seizure now? Or I like float tanks. Like what if I have a seizure when I'm floating, just enough water to drown? Like there's so many things of what if. And it goes back to the story I was talking about before surgery in 2010. What if I don't wake up? Rather than focusing on that, I focus on what am I going to do differently when I wake up? Not if, when, and how is that going to be different? So the moral of this story for me is this is something that's new. It's a new experience. It's a new challenge. Yeah, we're reacting to it, but I'm still being proactive with it, with everything that's in my control of choices. I know we don't have control over the life we live and the outcomes that we want and the goals that we want, but we have control to a degree over the choices we make and the way we think about things and perceive the information we're seeing and experiencing. So I'm just taking this, I'm recording this podcast. Hopefully I can, help someone relate to have gone through a seizure, a family member, a friend have gone through a seizure, something like that, or just any kind of obstacle. And just the ultimate message here is just to focus on what you can control. And that's your focus. That's your choices and what you're doing with the information that you're taking in every day. And so for me, I'm just trying to do everything I can. I'm going to go back to, first I'm going to wait on Dr. Friedman, Dr. Wu to give me their opinions. We're going to do whatever they say. If they happen to say opposing things, then we'll get a third opinion in there. I think they're going to be pretty on par with each other, though, knowing the two of them and my history with them. And then, I'm going to go back to the things I know are in control of my diet, which is just tightening things up a little bit. I still use exogenous ketones. I still use berberine. I'm just going to maybe not indulge so much. Definitely not going to consume alcohol anytime in the near future, whether that's indefinitely for the rest of my life or just for the next few months, years. I don't know. But I do know I'm going to take it one step at a time. And what I've been trying to, not get so frustrated with Jackie is, worrying about what we don't know and worrying about all the options that are on the table. It's just, let's focus on what is now. I'm well. I'm performing just fine mentally and physically. And we're just waiting on information. And then once we get that information, it's not going to change anything. It's just going to allow us to choose how we want to move forward. And my mindset's always to share this type of stuff in case anyone else is going through it or just to get it off my chest, because I don't believe in hoarding things in. I think that a lot of my past health challenges comes from suppressing emotion on top of a shitty lifestyle with sugar and alcohol and stress and all sorts of things. So at the end of the day, we have a choice in how we perceive the world we live in and our lives in that world, and what we're going to do about the things that we don't want and what we're going to do for the things we do want. And I'm a big believer in empowering yourself with those choices and asking yourself, are the choices inside and out aligned with the outcome I want in my life, or are they not? If they're not, then that's the sign that you need to change something. And for me, this was a wake-up call. Maybe I shouldn't be indulging so much. Maybe not. Maybe it's just the growth of the tumor. Then we need to pick that avenue of what we're going to do to treat it. I don't know. So right now I'm just taking one step at a time. And I just thought it would be interesting to have Jackie, from her experience, share about the seizure and what I've taken away from it as well.
The scary part is done, right? All that's left are answers and solutions, and that's where my peace of mind comes in. The scary part was him seizing and me not knowing why or what was going on. I mean, of course I know and understand that he has a history of brain tumors and brain surgery, so that was in the back of my head. But I was like, what if his tumor got bigger, or what if he's having a stroke, or okay, I get it. You want me to go back and correct it? Like,
yes.
What if the tumor got bigger, or like there's 4 of them, what if all of them got bigger? So it was just kind of not knowing, which was scary, and not knowing what his brain was going to be like when the seizure was done. So when he kind of like at first came to, he just looked really kind of like scared and nervous, and I was just trying to be a calming presence for him. But as soon as he was able to start answering questions and stuff, I automatically felt a lot better.
That was the strangest thing. Even though I bit my tongue like crazy, it doesn't hurt. Maybe it's because the time I almost bit it off in Denver when I hit my chin off my handlebars. That was more severe.
I told you, tongues heal really fast. They're just like muscle, so they heal really quickly.
What's also interesting is through that whole time, until I started having the thoughts of what if this happens again, I honestly I never felt a bit of fear, maybe because I wasn't able to comprehend fear at the time of what I was going through. But it was just like I said, when I first noticed it coming on, I just thought I was waking up, but then I couldn't see it. Everything was just so black. And then I just I don't know how else to explain it other than my brain was just scrambling. I don't know what was going on. And as that happened, and I think that was me perceiving my body shaking, I blacked out. But throughout everything, how I woke up and blacked out multiple times, from the bedroom to the ambulance to the hospital, I never felt afraid. I just felt this sense of curiosity of what the fuck is going on. And I don't know, I never felt afraid until I get to the hospital. And then I started thinking what if this happens again? And then I had the fear of falling asleep, because I thought, I fell asleep and that's what triggered it. I don't want to fall asleep. And then I started thinking, what if I'm afraid to sleep forever? What if I develop insomnia now? Which didn't happen. I slept like a baby last night. It was great. So that was interesting. It was just interesting to notice it coming on, to be coherent throughout the seizure until I got to a point where my brain just couldn't handle it and I just blacked out. And to not have fear until later on when I came to of the future, which is a fascinating thing, because human beings, we get so caught up in the future and the past, and we spend little time in the present. And this was me in the present, being forced in the present and not sensing fear, just sensing curiosity and this, I don't know, I don't want to say peaceful, but I just was disconnected from my body. I didn't feel my body doing any of that. So it's just really fascinating. I don't know, the brain's insane. And this makes me want to just dive more into meditation and plant medicine and just consciousness and deeper into the mind and just see what's there. Because I think a lot of these things I've been practicing, like float tanks for an hour or 2 hours, psychedelics and meditation, and different breathing techniques to where you get these weird releases and you're not quite with it. I think a lot of that prepared me maybe for this experience, to where I was just this is fascinating. And I don't have a sense of my body, and I'm not afraid. It's okay, but I'm just wondering what's going on. I don't know.
Yeah, we were both pretty well equipped for the experience, though. So We were a little fortunate. Like, right when he stopped seizing and he kind of like came to consciousness, he started kind of like swinging and like pushing me away. And I was like, oh gosh, like if he punches me in the face and I have like some kind of cut or bruise on my face when he wakes up, he's going to feel so bad. So I just kind of like laid on him for a second, and then he was done with that. And then he started like flinging the sheets and the blanket from the bed off of him. And I was like, okay, you're hot. Yeah, you're sweating. And I took them off, and they started trying to take off his underwear. And I was like, no, 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 like keep those on. And I don't know, it was such like a male response. I feel like
I hate being hot, so maybe
your first reaction your first reaction when you're like kind of like, I don't know, it's all subconscious energy, so it's just like, oh, first thing I would have done would, you know, maybe like clutch my chest or whatever, but like I'm like, the first thing a dude is worried about is like making sure like his balls are still there or something. I was like, what is happening right now? Like it was so weird. But you know, it just, people do weird stuff when they're in like a
Well, it was like
panicky,
when I woke up
unconscious
from
state.
brain
So
surgery and I had to pee, and they were like, "Just go, you got a catheter in." And I was like, "What?" And the nurse said to stop me because I tried to yank it out. And I was just like, not okay with that. But I was also drugged up a lot. So,
oh yeah. No, it's not. It's not like a, what's the word for it? It's not like a lucid state at all. Like he had no idea what he was doing. He has no recollection of that.
Yeah, I don't remember.
Like it was me, just like a lot of me anytime he was conscious, just like being like, hey, you're all right, it's me, like, do you know where you are? And then him kind of like looking around really worried, and then like passing back out essentially. And that was a little bit the scary part, but I was like, okay, at least he's awake and breathing. Like that's all that was important at that time. Yeah.
So crazy times, crazy things go on in my life apparently, and I'm just here to share them.
Yeah, but like I said, moving forward, all we have left moving forward are just answers and solutions, and
questions
so
and
that's
answers and solutions.
That's a positive thing, you know. Even if more questions do come up, like we're in really good hands, and I have the utmost faith in his team and in what we can do. I'm a little bit more worried than he is, but only because like I practice preventative medicine. That's what athletic training is a lot of the time. So I'm just like, okay, like when I went to shower last night, he was asleep on the couch, and just like, it was so good to see him sleep. But I was like, and I just shoved like the ottoman and a beanbag chair that we have up against the couch, because I was like, I don't want him to, what if he seizes and he falls off the couch, you know? And right now I took the day off of work because I knew I was going to be exhausted because I got no sleep, and it's like I had to like crawl up into the hospital bed with him a couple of times, and anytime we did that, it was like somebody else knew was coming in the room, so there was just no chance of getting sleep. But I also was like, I don't want to leave him alone the day after. You know, what if something else happens? I don't want him to be in the shower and possibly have another seizure. You know, the possibility of him having another seizure doesn't scare me, because like I'll just turn him on his side. I'll time it. If it lasts more than 3 minutes, I'll call 911. If not, we take note of it, and it's something else. It's another piece of information that we give to the neurosurgeon and the radial oncologist. And, you know, that doesn't bother me. I just don't want him to be by himself when it happens. Or like, I don't want him to be asleep and me not be here and him have a seizure and then not remember that he had one, you know, and not be able to share that information. So for me, I'm just kind of thinking ahead and trying to plan. And that's where my chill goes down a little bit, because I'm definitely a planner and a preventer. And even if the worst case scenario happens, I want to be prepared for it. It doesn't mean I think it's going to happen or that I am thinking about it all the time, but I'm like, oh, at least I got a plan, you know? So
that was another thing.
We're trying to balance him being like, it's going to be fine, don't even sweat it. And me being like, well, you know, there are some things that we need to do. And we try and find a happy medium between those two mentalities.
Yeah, when Jackie first got to the room, I got really emotional, because I was just like, I saw her and I was like, oh shit, what are my parents going to think? They're going to worry about me and like everyone else. And I just like feel like my life's been like a burden to other people. And that was something too that I had to work through, was just like, you know, it's just another day for me. Like I've been through worse, and it could be worse. You know, I'm alive. I could be, you know, impaired in many different ways. I could have not woken up. so many things. And so for me, it's just like another day. I treat everything in my BMX career. It's just like as an injury. It's like, oh, it's a little setback or a little speed bump. But what really gets to me now, being older and reflecting on the last even just 11 years, going through the first brain tumor and then, to where we are today, it's just like the toll that it takes on other people. And it was Russell Brand was saying something about this, like with people with mental health, it's easier for the person going through it than the people that care about them and take care of them. And, not that I've dealt with like mental health challenges like that on that level, even though we all do, with stress and depression and things like that. But obviously anything to do with the brain is pretty severe. And so just to acknowledge that other people like Jackie are worried about me and things like that, that's more, I think the most difficult thing for me going through any of the things I've gone through is understanding the toll it takes on other people. And me always saying like it's gonna be fine, like don't worry about things, especially things that we can't control and things that are not yet, we just are assuming the worst or trying to be preventative either way. It's just like, well, let's just focus on now. Everything's good now. Like I'm here, I'm talking, I'm smiling. We're eating, we're running errands. Like, it's all good, and we'll just sort out what's to come next from the information that we get from my surgeon and my oncologist. So
Worth it. Yeah. Worth it.
So with that being said, if you have an experience you want to share, either with yourself, a friend, or a loved one. Yeah,
if this has ever happened to you and you have insight, we would love to hear it. Just to see, we have some friends of clearly in the brain tumor space. Absolutely.
One of the first 10 episodes, Miles was on there sharing his story about how he went for multiple seizures a day, avoided a third brain surgery because the surgeon thought it was more brain matter left over from the tumor that they removed that was causing it, put him on a ketogenic diet, and then within weeks they subsided, and he just went over 500 days.
Amazing.
Still seizure free because of a ketogenic diet, and so that's pretty profound. So
I'm like, he's been like, I want pizza. And I'm like, no carbs, all keto. You're going to be in ketosis.
We'll make some keto pizza.
He's fasting. Like he did a little bit of fastings, and he's drinking a lot of exogenous ketones and things like that. We're just
pho for dinner last night. Some nice beef broth.
And he skipped out on the rice noodles and was sad about it. But, that's what we're doing. Yeah. So
we'd love to hear from you. If you got questions, if you got stories, if you have resources, if there's someone else that you think would be a great guest that can talk to this topic or anything that is gray, since this is the Gray Matters podcast. It's not just about brain matter and brain health, but it's also about those areas of life that aren't so polarized. Everything seems to be polarized this day and age, and social media plays a large role in that, as well as I would say the opposite of emotional intelligence. And so we just like to have these conversations to create a safe environment to be open and honest about things and to explore that middle area that is substance and context. And so we'd love to hear from you.
Yeah. And I do just want to say that I recognize and understand how fortunate we are so far that it's been a one and done thing, that we have access to some of the best neuro brains in the world. I want to say thank you to everyone at New Haven Hospital or New Haven Regional Medical Center out in Wilmington that was there for us. Even if, one of the doctors was a little snarky, we still appreciate your time and your energy. We felt very taken care of by my family that was out at Oak Island, who invited us out there in the first place, and, woke up at 2 a.m. and then did the most to help us, like make sure my car was with us at the hospital and take care of Cheddar. And even my intern that was watching Fred in our place for us while we were gone, he stepped up and stayed a little bit longer than he needed to. And we just are really, really fortunate to have the access to medical care that we do, and to have people in our lives that are amazing, truly caring individuals and people. And they really showed up and showed out this weekend, and we really appreciate you. And even the phone calls that we got and the messages that we got from people that we let know early on, it was very touching. And I am very blessed to have people in our lives that really do care about us and really would just drop everything to help us. And that's it's making me a little bit emotional, but it's a really wonderful thing, and it's a testament to our lives and how fortunate we are. So thank you guys so much.
Yeah, definitely. Thank you to all those people, and thank you for those that are listening. And again, if you have anything you want to contribute to this conversation, we'd love to hear from you. And if you want to chat, or if you know anyone that would be a great fit to chat, whether it be seizures or just anything to do with gray area of life, then we would love to hear from you. So till next time, maybe we'll get Jackie back on some more episodes so it's not just me. And we appreciate you guys, and we'll talk to you soon.
Love you.